Good morning, everyone. My name is Dr. Irina Rybalov. I'm from New York, and I'm an oncologist, and I have today with us Dr. Bob Rakowski. He's a chiropractor. He's famous in the field of integrative health. He owns a big a chiropractor clinic. He has a lot of famous clients. He does interesting work on athletes, on people who strive for better health, and he's using he's in Texas, Houston, Texas, and he's using the product which we'll be talking today about, which contains medicinal mushrooms. It's organic gold product. Welcome, Dr. Bob.
Well, thank you. I like to tell people a little bit about my history in nutrition and cancer. And within my first few years of clinical practice, I had treated professional athletes from nearly every major professional U.S. sport. And these athletes improved dramatically and fast. And some of them started to ask the question, I've got family members who are not elite. In fact, they're the opposite of that. They're really struggling. Do you think some of these protocols could help them? And I would take on protocols with relatively sick patients and was very impressed with how their bodies responded. My first few years, when someone would refer a cancer patient for a nutrition consult, I would just tell people, at this point, I don't feel that I know enough to be of value. So I'd send them out to respected people in the community, but I'd follow up with the patients and I'd look at their protocols. Well, after doing that for a few years, it didn't seem like they were doing anything really dramatic or revolutionary. So I decided to spend a full year studying nutrition and cancer and really breaking down the pieces. And the very first cancer patient that I took on in my office was a woman with her third recurrence. She had cancer of the jaw, and she had a daughter who was coming in from Israel for the summer. And she said, you know what, I don't want to spend my summer sick. I don't want to spend it with chemo and radiation. Can you help me with nutrition so I can be strong when I start the conventional therapies? So we put her on a really solid program, and we'll talk about the components of that and how they've expanded. And for about 4 months, when she went to MD Anderson, the major cancer hospital in Houston, for her pre-chemo workup, she was incredibly surprised, as were the oncologists, that her cancer was gone. So that was a really good start. And we'll share those strategies with you and your listeners and colleagues. One of the things that we want to understand is that even though cancer is a problem with the genes, it is not inherited. So it's basically the consequence of really toxic and malnourished and stressed environmental exposures. When you look at the best of the best out there, and here's a peer-reviewed medical study, and I'll often have the PubMed ID, the consensus is that about 5 to 10% of cancer risk is genetic. The other 90 to 95 is environmental. And we could show data going back to the late 1800s when they were doing autopsies on everybody. And it's surprising for people to know that if a child lived to be 5 years old in 1800, the average life expectancy was 80, and they were usually very, very productive up until the very last month or so of their life. And it's estimated that only 2% of 80-year-olds died from cancer, and now that number is over 22%. So how do we go up 11x? This is a fascinating study from Frontiers of Cell Development Biology. They took a normal cell and they took a tumor cell, and they literally swapped the genetic material. They put a cancer nucleus into a normal cell body. They also put a normal nucleus into a cancer cell body. And great article to read, when they put the cancer nucleus into a normal environment, it produced normal cells and vice versa. So here's the takeaway from that. So how do we create the environment that prevents cancer really should be the question that we're asking. A healthy environment produces healthy cells, even when there is genetic disruption, whereas a sick environment promotes sick cells, even when we have healthy genetic material. I was at a cancer lecture over 30 years ago. A PhD researcher, Dean Black, walked into a room of 200 doctors, and he asked the question, how does a hurricane start? And the answer he was looking for was that a hurricane starts when conditions are just right. He then asked, how does a tornado start? Well, when conditions are just right. How does cancer start? Well, when the conditions are right for cancer. So these are well documented in the medical literature and have been for a long, long time. The conditions of cancer are low oxygen, low nutrients, high acid, chronic inflammation, and immune suppression, usually secondary to chronic distress. So I tell my patients, the way you decide to get rid of your cancer should be based on your type of cancer and your value system. But we always want to change the environment that allowed cancer to occur in the first place. For years, I've talked about the Magnificent Seven. I tell people you've got to eat right, drink right, think right, move right, sleep right, poop right, talk right, every single day. And you had mentioned a case that I shared in Toronto at the Perfect Practice. And this beautiful lady, you can't see her beautiful face at the moment, Hannah Cohen, had a massive brain cancer. And the day she found out was because she had a massive convulsive seizure. They rushed her to the hospital, put her under a scanner, 9-hour surgery. Some of the cancer had infiltrated life-critical areas, so they couldn't get it all. And the doctors told her, you know what, I'm sorry, this is very aggressive. We don't have much to offer. You've probably got about 12 months to live. Well, Pete and Hannah came to Houston, Texas, sought out alternative cancer therapies, and they also came to my office for nutrition and lifestyle advice. I wrote the foreword to Hannah's cookbook, which is one of my favorite forewords because she's such a powerful story. And there's Hannah and Pete just 6 months ago, and cancer-free and for 5+ years, and really enjoying an absolutely beautiful life. She has a video blog, and maybe if I shorten that or made the font smaller, it's literally all one word, teamhannah.com. And you can go and follow her story and order her cookbook and just enjoy the process. So I have read, I'm guessing, well over 1,000 peer-reviewed medical articles on cancer over the course of the years. 3 times I've taught at the International Nutrition and Cancer Conference. I taught at a major conference last fall, and I have a public figure Facebook page, Dr. Bob Rakowski on Facebook, and I have that nutrition and cancer audio. But I read a number of books in addition to the articles, and this is Kelly Turner, who received her PhD from Stanford when she wrote the book Radical Remission. So she was looking around and wanting to study how people beat cancer. And she said every single oncologist that she talked to had some patient that beat cancer when they weren't supposed to survive. People like Hannah. She would then ask the oncologists, well, have you published these cases? And they all said, no, we're too busy. And she said, all right, I need to publish these cases and share with the world what people have done. So these are the 9 steps that people engaged in consistently to beat cancer when they weren't supposed to win. And by now, she's looked at over 1,700 cases of people that have beat their cancer. So number 1, radically change your diet. So people may be familiar with a PET scan. They put radioactive sugar in the body, and then the cancer cells light up. Why? Because those cancer cells are eating the sugar. We used to say 10 times as much as normal cells. Now we know that cancer cells eat sugar 30 to 50 times as much as normal cells. So not only does cancer eat sugar, cancer cannot survive without sugar. And so therefore, you want to have a low glycemic index, low sugar, low starch diet. And this was one of the 9 things that people consistently did. Relatively solid reference now, almost 24 years ago in the Journal of the American Medical Association. And here's what it said. At every step along the road to malignancy, at every step of the cancer process, plant chemicals or plant nutrients tend to reduce the likelihood of transmission to the next stage. So different references will talk about different stages of cancer progression. One study I read years ago, it had about 12 stages in the progression of cancer. And understand, at every one of those 12 steps, a high plant diet and the chemicals of nature, nature's pharmacy, prevent the progression of cancer. Number two is they actually took control of their health. So I like this quote: "I am" is one of the most powerful statements that any human being can make. Compare that to "I've got." Someone gets a diagnosis and they go, "Oh my gosh, I've got." So one of our mentors, Sachin Patel, and I had a deep conversation about an hour long about cancer before that last cancer conference. And I'll share his statement in a moment. But I always like this poem. It's actually called Invictus, where the powerful statement in it is, "I am the master of my fate. I am the captain of my soul. I am the master of my body. I am the master of my environment. I am the master of my emotions." And if you literally are that master and take control, then you can create the life of your dreams. So when we look at someone that says, "I've got cancer," versus the person that says, "I created cancer," if you've got cancer, you're a victim. If you're a creator, you're a creator. So you created it. Now create the environment where it goes away. And so the term patient literally comes from the Latin word which means suffering. And there was an article in the peer-reviewed medical literature within the last 2 years that the title of it was, "Do we need a new word for patience?" So literally, patients will suffer or bear, and it's a passive circumstance. Whereas we want patients or individuals that are actively involved in their care, actively creating the environment where they're going to win. The third step was to follow your intuition. What does your heart say? So understand, if these doctors are administering chemicals, or maybe not the doctors, but whoever the staff is, and they're wearing hazmat suits where they're protecting their entire body and being from any contact with this, you have to ask yourself the question, how in the world can this be healthy? Now, I'm not against chemotherapy. If chemo is proven to help cancer, for that type of cancer, well, then it may be a very good idea to do it. Remember, however you get rid of it, you should do it in a way that makes sense, but always change the environment. And as we move forward, and the reason we're having this conversation today is there's a superfood called Ganoderma, also known as reishi. You'll see the references, where it actually enhances the killing effect of chemotherapy, where it enhances the killing effect of radiation, where it preserves muscle mass in the patient, where it enhances the immune function, where it dissolves a protein coat on the cancer cell, allows the immune system to get after it, all the while protecting the patient. Very, very powerful. But use your intuition. If someone says, "You know what, we're going to feed you sugar and give you poison and diet doesn't matter," see how that resonates with you. I can tell you with my patient base, it doesn't resonate at all. 4 is you basically want to be grateful for everything. So this book, The Tools, is written by 2 psychologists, Phil Stutz and Barry Michaels. And they talk about how when people are in a state where they're not having gratitude, they just can't feel the goodness of the universe. But you can be grateful for a lot of different things. You know, if you wake up this week, you're going to be very, very different than 1 million people on the planet who've moved on. If all of your loved ones have woke up this week, again, you're in a better position than so many people on the planet. So here's an absolute fact. Grateful people tend to be more optimistic, and that is known to boost the immune system. You want your immune system active when you're fighting for your life. When we start looking at conventional cancer therapies, I find this study very, very fascinating. These are colon cancer patients at every stage that decided to take on integrative therapy. So at stage 1, if they took on integrative therapy, they prevented death by 95%. Stage 2, 64%. Stage 3, 29%. And stage 4, 75%. Now, when you look at that, you might ask, well, wow, I thought stage 4 was much worse than stage 3. It is. And one of the things that may be happening here is that the individuals with stage 4 were more motivated. You want to increase your positive emotions. That's going to go back with what we said previously about having gratitude, and that will boost the immune system. In radical remission, they also said you want to release suppressed emotions. So understand emotions are changing your chemistry. Everybody knows this. If suddenly you get angry, you poison your body with your chemistry. If you become sad, you poison your body with your chemistry. There's a lot of people that have a deep underlying sadness or anger or resentment that they're not dealing with. And this is a peer-reviewed medical study that showed that if individuals were known to have had suppressed emotions, the risk of cancer death went up by 170% over the course of 12 years. Very powerful. You want to have social support. I was at the front row of a TED Talk where Dan Buettner was presenting the blue zones. And these are areas in the world where people consistently live to over 100 at a much higher rate. And they had love, and they had purpose, and they had social support. And here's a study right here. It showed that women who were isolated were 64% more likely to die from breast cancer. And by the way, 69% more likely to die from any cause. So you want to have a community, you want to have friends, you want to be involved in this beautiful world. How about deepening your spiritual connection? So it may be something that's not really taught about in conventional science, but most people will agree that there is a force that rotates the planets, that keeps everything moving around the universe, that even starts the force of life within your body. And when you recognize that force and when you connect with that force, it's no doubt that your survivability and your quality of life will improve. And then finally, a strong reason for living. So the very first major conference that I lectured at was in 1994. So we're going back 25 years. And the keynote speaker was Bernie Siegel. He's a Harvard medical doctor, and he was talking about his book, Love, Medicine, and Miracles. I was the speaker before Bernie Siegel, so it was fun to be that warm-up act. But he loved people to have a reason for living. And he would ask his patients, do you want to live to be 100 years of age? And by the way, he said the answer to that question was the best prognostic indicator for his patients. So what I tell people is that very first cancer patient that I described, the one with the cancer in her jaw with her daughter coming over from Israel, I asked her the question. I said, do you want to live to be 100? And she looked at me and she said, no. And I sat in my chair a little dumbfounded for a second. I said, okay, how long do you want to live? She said, I would like to live another 13 years. And I asked, what happens in 13 years? She said, well, my youngest grandson will have his bar mitzvah, and I want to be there. I said, all right, very good. Let's get you there for your grandson's bar mitzvah. So Bernie Siegel, here's what he says. If you see what you do each day as your way of loving the world and helping it heal, then life gets to be a lot different. The difference between burning up and burning out is the difference between loving what you are doing and not loving it. Wouldn't you want to have so much excitement that each day was a gift? I like sports, so I'll quote Vince Lombardi. He would tell his players, if you're not fired with enthusiasm, you will be fired with enthusiasm. So now we'll talk about Ganoderma and how it works in clinical practice. I have some lovely pets here, and I also have a landscaper that'll be here soon, and sometimes the pets make noise then, but all right. So this is a study on Ganoderma. Anybody can look up the PubMed. So just for the sake of the audio, PubMed ID 296-91994. This is the exact words in the article. It says, after more than 40 years of clinical use, its efficacy, safety, and long-term tolerability have long been recognized by neurologists. It reduces adverse reactions and improves the quality of life for cancer patients during chemotherapy, and it also breaks down muscle loss. So understand that cancer is very metabolically inefficient. So if normal cells of my body get 36 miles per gallon, I've got a car in the garage where, it actually doesn't quite get 36, but we'll use that for argument's sake. If a cell gets 36 miles per gallon, a cancer cell only gets 2 miles per gallon. So as that cancer starts to expand, it starts burning up fuel very inefficiently. And then the body literally has to break down in its attempt to survive. The term for that is called cachexia. So it's not that cancer eats lean tissue, it's that the body breaks down its own lean tissue, trying to run its own life-critical functions, because cancer is such an energy hog. So again, don't feed the cancer, and do feed your body ketogenic with a lot of plant nutrients, and take Ganoderma. Ganoderma is proven against 12 different types of cancer. So it's breast cancer, prostate cancer, inflammatory breast cancer, leukemia, lymphoma, multiple myeloma, cervical cancer, melanoma, lung cancer, pancreatic cancer, colorectal cancer, cholangiocarcinoma. It's also pretty powerful against some of the worst bacteria and viruses on the planet. But I might just blow this up for people to look at it later, where people will say, well, wait a minute, I actually want to be able to see what all these PubMeds are, and what Ganoderma can do, and look at that and freeze frame it, and just feel free to look up all those PubMeds. Super powerful. Another powerful one here, and I'll bring it down more into a viewing screen. This was a study where they used a chemotherapy called doxorubicin. And when animals were given Ganoderma and doxorubicin, they killed their cancer more effectively. And they also prevented that chemo, which is known to damage the heart, from damaging the heart. Cisplatin is very harsh on the kidneys. Again, an animal study. They gave animals cisplatin and Ganoderma. They killed their cancer more effectively, and they preserved the function of their kidneys. This is a liver cancer radiation study. Ganoderma enhanced the killing effect on the cancer of the radiation while protecting the normal cells, and Ganoderma is also known to prevent chemoresistance. So when you look at that, you might ask the question, well, why in the world is this not standard of care? Well, we have a little different system out here. So this system is very financially driven. You cannot patent a molecule of nature, so there's nowhere near the money as there is in the cancer drugs. And keep in mind that our healthcare system or sick care system does need to be profitable. So unfortunately, it drives a lot of it. Here's a study on highly invasive human breast and prostate cancer cells. When they gave these individuals Ganoderma, it resulted in suppression of cell migration of these highly invasive cancers. So I want you to think about that. If a woman has a breast cancer and it just stays local, it's actually relatively easy to get rid of that. And in fact, if it stays local, it's not likely to ever risk that individual's life. It may grow, but if it doesn't spread throughout the body, it's not going to be deadly. Same thing with prostate cancer. And they have localized therapies. In breast cancer, they can do a surgery, cut around the tumor, not into it. Prostate, they can use radiation seeds, prostatectomy, proton beams, things like that. Melanoma. So this is from the journal Oncology Letters. And melanoma and other cancers hide from the immune system, almost like a wolf in sheep's clothing. Ganoderma blocks the effects of hiding from the immune system, so it unmasks it. So we'll have time for questions in a bit, but this is Dr. Dean Ornish. I've actually co-lectured with him at conferences. And he published a study where they showed that over the course of 90 days, they could turn down the expression of over 500 different genes related to cancer. So I'm in a room that has a light, and the light could have a dimmer switch, right? So we could turn down that light and make it less intense. That's what they're able to do with over 500 cancer genes just by modifying the lifestyle. Dr. Ornish was interviewed, and they asked him, okay, Dr. Ornish, if these changes seem so simple, and they appear to be, diet, exercise, stress management, why aren't more people doing it? And Dr. Ornish said this. He said, we associate pain with change. We associate pain with diet. We associate pain with exercise. So in this book, The One Thing by Gary Keller, he repeatedly asks, well, what is the one thing that you can do that in doing so would make everything else in your world either easier, or not necessary at all? And here's what Dr. Ornish said. He said, sustainable changes must be pleasurable. So think about that for a moment. Do you know people that drink coffee or tea, or possibly a weight loss shake with a very high quality protein? Well, all of these things are available infused with Ganoderma, and they're available to everybody watching the Zoom and literally everybody on planet Earth. So I like to suggest, because there will be replays, get back to whoever referred you to this Zoom, and then ask them, hey, I'd like to try some of this Ganoderma coffee, some of this tea, some of these shakes. When you look at Ganoderma, and I talk about the Magnificent Seven: eat right, drink right, think right, move right, sleep right, poop right, talk right. It increases brain circulation and 4 major neurotransmitters within the brain. That would be serotonin, GABA, acetylcholine, and dopamine. It's anti-inflammatory by a dozen different mechanisms, also alkalizes the body, making movement more pain-free and every process efficient. It helps the liver, it helps the kidneys, it helps the lymphatic system, it helps the skin, it helps the bowel, and so we can eliminate toxins more effectively. It is considered the top superfood on the planet by many sources, meaning it has all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water. It converts normal water into alkaline water, oxygen water, smart water, energy water. As a GABA facilitator, it helps people to sleep. They actually are known to fall asleep faster, sleep deeper, longer, wake up more refreshed. And it does enhance the efficiency of all cell communication throughout the body. And by the way, when it comes to cancer, loss of cell-to-cell communication is considered one of the very first steps. So often I'll be at a conference and I'll look around the room and I'll say, oh, as I'm here, I don't see any individual sitting on anybody else's lap or stealing their food. Well, that's what cancer does. It crowds your space, it steals your food. Oh, and by the way, it poops and pees all over you. And it's a real bad guest, right? So we want to kick those out of our home. So with that said, that it completes what I have prepared about the natural side of integrative oncology. But I'm certainly happy to answer any questions if you happen to have some. So you may raise your hand or unmute yourself or whatever works best. Any questions from anybody about anything? Anything at all?
Dr. Bob, it's
Yes.
Irina here. So what is your recommended dose of Ganoderma lucidum for somebody who has advanced stage cancer, stage 4, along with everything else, what they do?
So what I like to do is start with a loading dose. And I will often recommend, there's 3 parts of the plant and they're available in capsules, but the spores are the most powerful. They're certainly coming to be the most proven in the field of oncology. Some of the nutrients within it are 75 times more concentrated. So with that said, I will often have cancer patients do 2 spores every waking hour for 7 to 10 days because their body has to start controlling the inflammatory process, start alkalizing, start picking up the immune system. And then we usually maintain it with 3 spores 3 times a day. And then doses of coffee and tea. For a lot of people, coffee and tea helps them to stay more hydrated. And our coffee and tea, instead of dehydrating, rehydrates, alkalizes, etc. So I got 2 spores every waking hour, replace every coffee and tea with this, and then 3 times a day, usually maintains. If people are going through cycles of chemo and they want to get their body most prepared, and we know most people aren't too hungry or thirsty during chemo, they can often do a loading day with 2 spores every waking hour. I've got some patient testimonials on my Facebook page, but I have a young lady with a really aggressive breast cancer. She was doing a chemotherapy that she nicknamed the Red Devil. Her first dose put her in bed and very, very sick for nearly 10 days. And then she had a gap in between that. We loaded her up on Ganoderma. 2nd dose of the Red Devil, she was only in bed for a day. 3rd through 10 dose, wasn't in bed at all. So this can be a very powerful strategy to help the process and certainly help the recovery. And again, over 40 years of clinical use. People can look that up with that PubMed ID. This is not new. This has been used for a long time by oncologists.
What about the athletes? I know you have a large group of athletes who you care of. The doses are different for them or the same?
Well, if they're getting ready for something and they have an injury or something happening, well, then we are going to give them a loading dose. So one of my favorite stories, and I can show the picture. I have an individual that I treated named Tyson Gay, and I think I have to copy the video for a new screen, or the picture for a new screen share. Oops. But when I treated him, his body was very acid, and he had a big race coming up in a few weeks to race a guy named Usain Bolt. Well, within 2 weeks of alkalizing his system, he beat Usain Bolt head to head in the 100-meter race. And that resulted in him signing not $100 million, but $1 million endorsement with Gillette. So very fun deal. So often with athletes, when we're trying to make a significant change in their chemistry, and people can YouTube that, by the way, it's a fun video. We dose every waking hour, and athletes are very in tune with their body. They will often feel the difference with the very first dose. I had a professional boxer in yesterday. His name's Jericho Walton. He's 14-0, big, strong guy, and he actually loses weight, cuts weight in time for the fight. And I've been working with him for 3 years. But since we started him on Ganoderma, his weight stays more in check, and it's so much easier for him to get down to fighting weight and be strong in the process. So all bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And we take advantage of that in every case. But if you look at who really needs it, the critically ill certainly need a lot more doses, a lot more frequently. The athletes are motivated because their livelihood and a lot of joy is dependent upon their health and competitiveness.
So doses are like the same, would be like 2 sports every waking hour for the athletes, roughly?
Yes,
Okay.
and that, 7 to 10 days is the time frame. And when you think about every waking hour, it's certainly an investment in effort and even money, because the spores, have a price to them, because they're the most powerful part of the plant and the hardest to harvest. But when you look at the return on investment, having done this for so many years, I can tell you that I can't recall a single patient that regretted the investment of time and effort. The changes can be very dramatic.
When do you use mycelium? I understand this is usually applicable to patients with degenerative disease of the brain, Alzheimer, dementia. Can you talk a little bit about that?
Sure. So there's 3 different parts of the plant. The mycelium is the root system. The Ganoderma lucidum is the flowering body. The spores are how it replicates. And since it replicates, it has a concentration of nutrients. But traditionally, herbalists have looked at the structure of plants and said, okay, whatever that structure appears to match, that would likely be the system that it's most beneficial to. So the root system is a branching architecture that goes out all over the place. And that's what our nervous system does. So the mycelium has traditionally been used for that. We have patients that have extraordinary benefit with the mycelium for brain function. One of my second associate doc years ago is a master herbalist, and he started an herbal company, all organic, wildcrafted, called Weed Botanical. But I wrote the foreword to his book. And the first line of the foreword is, there's a synergy in nature that can't be duplicated and can't be isolated. So the master herbalist would say, use the mycelium, and you can dedicate that for central nervous system issues. Use the flowering body, the Ganoderma lucidum, and use the spores all simultaneously to get the maximum synergy for the plant. So usually when I'm targeting a specific area like the brain, the mycelium is a good choice. When people want the overall total benefit for maintenance, all 3 parts of the plant daily, 1 capsule of each, is a great choice.
Okay, great, thank you. I don't know if anyone else has any questions.
We'll see if anybody typed any chats or comments or anything in the bar. We've got a wonderful group of people that have joined us this morning. You know, if that's it, I certainly want to thank you for all the good that you do in the world. We certainly need oncologists that understand that cancer patients benefit from better health. It's almost shocking when you and I look at the world and ask, how can they feed them Doritos and Coca-Cola, but they just don't have any training in nutrition? But that's where your philosophy, your dedication to your own health, and your willingness to share with the world is absolutely exemplary. So I'm honored to have you as a colleague, as someone that I can refer patients to that need really good advice from someone who has your level of training. One person typed in, have I seen any value treating MS? Yes, there's a peer-reviewed medical study on Ganoderma that says that Ganoderma can be used to both treat and prevent autoimmune disease. I have a Zoom as part of our organo groups, specifically on the immune system, immune modulation. There's certainly more to autoimmunity. There's 4 major immune modulators, the adrenal hormone DHEA, vitamin D, 3 different Chinese botanicals. One's called Perilicy, the other's called Cordyceps, the third is Ganoderma, appear to have universal immune modulation. And then, of course, we want to seal and heal the gut and not have aggravating foods and buffer the stress. Autoimmunity is a problem because our individuals are so ill. One of our normal immune functions is to weed our garden, to kill cells as they go bad. And part of it is going to be to kill cancer cells. And statistically, it's likely we all get cancer cells every day, but other cells that become sick need to be cleared out as well. So Ganoderma is good for that, as is a complete protocol. And you are certainly very welcome for the talk. We will post this. So I will send you a copy for your own Facebook page. I will post it on my Facebook page, on my public figure page, and we will share it in different organo groups. So with that said, looks like all the questions are complete. A very heartfelt thank you to you. Please share this with the world because the world needs to know. Any final comments for us today?
I think it was amazing talk, and we have learned a great deal, and I hope people start using Organo product more. So thank you for being with us today. I appreciate every word you said today. It was great. Amazing talk.
Thank you so much.